You're watching The Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting dentures. No more dentures. With us, we've had him on the program before discussing dental implants, Dr. Kelly Olsen. Dr. Olsen, welcome to the program.
Thanks, Randy. Good to see you again.
Thanks. Now, I know you brought a lot of photos, so we'll try to get to as many of those as we can. But for people that don't know your practice, who's the typical patient and who's coming in for dental implants?
In my practice, the typical patient is really anybody. I see kids all the way to people that I've had patients that are over 100.
So why would a 90-year-old want to do that, though, get dental implants?
Well, 90-year-olds, they want to eat and chew just like everybody else.
Okay.
They want to eat and chew just like everybody else. I feel the same as I did when I was 18 inside. And when I talk to my older patients, they feel the same too. They still want to look good.
All right.
They still want to eat apples. They want to eat corn on the cob. They want to be able to function well and chew and eat a steak if they want to. I had a lady that came in 72. She comes in and couldn't eat. The typical story when they come in, they've had a denture for a while. So she asked me if there's anything we could do. I said, yes, we can. You've got a denture already. I can put implants in same day, and we can have you eating when you leave my office today. Now, she came from 3 hours away, and she was stunned. She didn't realize she could get it done so fast. So we went ahead and put some implants in for her that day because she traveled so far. She came back. Not only did she come back, but she came back and said, look, I need my husband to do this.
Because he was wearing dentures
Because
too?
he was wearing dentures as well. And so when her husband came back, and he was wearing dentures for decades and didn't really think he needed them, but she was so excited about her result, she came back with her husband. We put implants in for her husband. And he said, you know what, Dr. Olsen, I should have done this 20 years ago. Her husband was 92. So people in their 90s, they appreciate
So they're not more likely to fall out if you're 90 years old?
No, of course not.
So 70 is very young then to do this?
70 is very young. 70 is common. We do that all the time. So yeah, someone in their 90s, it's their bone. Their bone, just because they're 90 doesn't mean their bone's bad.
You had me watch one of your videos, and the patient wanted to know how long it was going to take. They thought it was going to take a couple of weeks or whatever, and you told them this afternoon.
That's right.
Is that right?
That's exactly right. A lot of people have heard teeth in an hour, that kind of thing, and I just taught a seminar for a retirement community where I live. It's called Sun River, and everybody has the same questions. They want to know the same things. And one of the questions is, how soon can it be done? Can it really be done in an hour or the same day? Most of the time, yes, it can.
It could be done tomorrow. So if they're at your meeting, you can say, it's possible we can do it tomorrow.
Right. The gentleman I talked to you about came in that day with an old bridge sitting in his hand, and he wanted it fixed, and he thought it'd take a couple of weeks. That afternoon, he was leaving with a full set of teeth. His teeth were so bad we had to take them out. He left with a full set of teeth that he never has to take out. They're his permanent teeth now.
So at the top of the show, when we say no more dentures, I mean, you believe that. That means the future of dentistry will be that traditional dentures are gone.
That's right. They are. They really are. There's obviously some cases where people can't. So it's not fair to say everybody will, because there's medical conditions and things. But by far, the huge number of people can have permanent teeth. They don't have to have dentures
anymore. And they can eat whatever they want, right? So, I mean, you could take a denture wearer, right? Or somebody, the other group of people, I guess, the people that their mouths are falling apart, crumbling out. They know that they are headed to dentures. Are their gums too bad to get this done? Can they do this too? The people with bad gum disease?
Absolutely, because it's almost like a redo, a do-over when their gums are bad, because we start over, get their gums healthy, and then we have their bone that we can use, but when we place the implants, we put them at a level where they're healthy now. So it's almost like taking your tooth and moving it down in the bone, if you can picture that. So now it's in a good place again. And then we have them come in, we help them maintain them and clean them and take care of them.
So it's just like their own teeth.
It's
like they come in for checkups
again.
A couple times a year?
Right, we've taken their teeth and repositioned them, so now they're healthy again, and we help keep them healthy so they can have teeth again, permanent teeth that they don't have to take out. Remember, they can eat apples now. They can eat beef jerky. They can eat
with
corn
their
on the
front
cob.
teeth?
With their front teeth. They can chew the apple. They can eat anything that they want now, and they're excited about it, and they're in tears. I've had people just literally in tears. They're so excited and so happy and so appreciative that they have this new lease on life.
Now, one more thing. I guess how, and correct me if I'm wrong, so how it's normally done when you want to get dental implants, you go to one person, like the surgeon that puts the implant in, and you go to another doctor that puts the teeth on top, and maybe somewhere else for the imaging. You do it all right there.
That's right.
Is that right? So you're trained in all those areas.
That's right. Yeah, I've been in practice now for 21 years. And I had the fortune to learn about dental implants in dental school. There weren't any specialists in our dental school. It was all dental students and no specialty programs, which that means we got all the difficult cases to learn from right out of dental school. So as soon as I started practicing, I was able to do implants immediately. So I have a lot of experience to learn these things and, of course, share it with other doctors.
You say it changes people's lives.
It does.
Are there a lot of people in Utah that have, that are missing like an upper lower denture or headed to dentures?
They are. Let me tell you, there's 5 things. When I look and I ask these questions, and I taught this seminar, and all these people, they have the same questions. And the first thing is they don't know. They've had dentures for so long. They haven't been to a dentist because they don't think they need to go. They usually don't go. So they're just out of the system.
So if it's so good, that's my question. Why aren't they all doing this? They just don't know.
Yeah,
because they don't go to the dentist.
They haven't been to the dentist. They don't know. They don't know the options. Then it comes with the other questions that they ask. They all think it's too expensive, so they think it's too costly. They're afraid. They're so afraid because when they were young and they had teeth, they were usually done without anesthetic when they had dental work done, or it hurt, or they remember some bad experience. They have so much fear they don't want to go. They think it takes too long to do. They don't realize it actually can be done in most cases the same day.
Do they ever come in and say, "Are you sure you could do this right away?"
Every time.
They're skeptical.
They're skeptical. They're surprised. They're shocked. We can do it today? I mean, I ask them, how soon would you like to get it done? Oh, how about tomorrow? Okay.
So they can walk in without teeth and walk out with teeth?
Right.
Really?
They can. And that's usually what happens. If they have, like this gentleman I told you about at the beginning of the show, he left with teeth. And then the last thing that I would say is that some of them don't think they're a candidate for dental implants.
Well, how old can you be to get this done? Well, we talked about, like 90 years old.
Right. 90 years old. There's not a limit to your age. It's really your health. Here's the thing. If they're healthy enough to walk into my office, they're usually healthy enough to do dental implants.
To get this done. And pain is not something you say they really complain about, because I guess the bone doesn't really have feeling.
No. It's very common. 90% of the people that I see, when they get the dental implants done, the next day, and I think I showed you a video at the beginning of someone that came in the next day, they come in and they're shocked that they're not bruised, they're not swollen, they're not having pain. That's what we don't want. That was one of the main things. People don't want pain. I don't blame them. I don't either.
Okay.
So it's not. The other 10% of the people might have a difficult time depending on who they are, but 90% of the time, there's not a lot of pain afterwards.
Now, you brought photos. What are we looking at?
I did.
Because these are dramatic photos. People need to know. I'm not siding with you. I'm not endorsing you. I'm just asking the questions. Right. But I did flip through some of these photos, and I think people need to stay here to look at this, because it is huge difference in their appearance.
It is. It's huge. And here's the thing, though. They're not just photos. These are stories. These are real-life stories of what people have gone through for their life. They started with teeth, and then they get cavities, and after they get cavities, then they get root canals maybe, or they had to get the teeth pulled because when they were young, they go through this evolution, and then they get their teeth pulled and they don't know what to do, or they're in that state, they don't want them. The stories are the big thing that I want to share with you.
All right.
But the pictures obviously will help you see how good it came together.
Okay.
So this is Jack. I love Jack. Jack, he's a retired professor now at Dixie College, Dixie University now.
All right.
Where I live. And he came in with some pretty significant problems, just swelling and just difficult, wanting to know what his options were, wanting to know about implants, if we could do them, if he was a candidate. The same questions everybody else has. So Jack did not want dentures. He was headed to dentures. He was ready to make the commitment to take care of his teeth and do whatever he needed to take care of them. So we were able to help him stay away from getting a full set of dentures.
All right.
So about half of his upper teeth we did implants with. And now he's healthy. He comes in. He's made such a great commitment. He's been with me now for probably 12 years. And now, this is what he looks like.
Very nice.
Now, I want you to look at both of his smiles. This is a happy guy. And you know what? He was happy even when his teeth were bad, but he still had some reservations. And now you can't stop him from smiling when he comes in.
So he can eat whatever he wants.
He can eat whatever he wants, and he does. He does.
Do you hear eating stories all the time, by the way?
All the time. What do you think the two things are everybody wants to eat when they come in my office? What would you think?
Steak? Corn on the cob?
Corn on the cob.
An apple, I guess?
And an apple, of course.
Or broccoli,
broccoli.
Can they eat popcorn with these teeth?
They can eat anything.
Okay.
I mean, the apple and corn on the cob is what everybody says, or a steak. You nailed it. Because you're like everybody else on the planet. We all want to eat what we want to eat.
Could they eat chewy food like pizza?
They can eat
so it doesn't
anything.
matter. Okay.
They can eat anything. Right. There's not really any limitations. We still don't want them to eat Jolly Ranchers and hard candies and stuff that'll hurt your natural teeth.
Okay.
But yes, they can eat anything you want. Let me show you a couple others. This is Harley, and you can see his teeth here. His teeth.
They're like gone.
They're like gone because he's a rodeo guy, and just clenching his teeth and riding in the rodeo and this guy's in his 20s. And he's a very clean guy. He's a great guy. I mean, but you would judge him and think, this guy doesn't take care of his teeth. And so afterwards...
Was he also normally would get dentures?
Well, that's what his question was. Do I have to get dentures? And so we talked about that. And he didn't want to. He said, look, I don't want anything I have to take out. And he's only in his 20s.
Yeah.
You don't want to have to take him out. So let me show you what he looks like now. Think about this guy. If he's going in for a job interview or something like this, who would you hire?
Wow.
Would you hire, which one? Same guy, but amazing.
Well, you hire the one that looks positive, I guess.
Of course you do. Of course you do. These are real things. I mean,
going into this, because we've talked on the phone, and I feel like you're exaggerating a little bit on the telephone, right? But anybody can look at this photo and see that it changes your appearance.
Yeah, look,
very
Randy,
interesting. But how you feel about yourself as well.
It sounds like I'm exaggerating, and I can see why you would think that. I'm not exaggerating. There was one lady that came in after we finished her teeth, and she came up to me, gave me a big hug, and she was in tears. And this isn't an uncommon experience to happen. Gave me a big hug and was in tears and said, thank you for changing my life.
So you say you see changes in how they act?
They're everything. Well. Let me show you a couple of them. This is a smile. This gentleman right here. You look at this gentleman.
Oh my goodness.
Once again, another person that's
got to be unusual though.
No, it's not unusual. This is a common thing. You see this all the time. I see this every day, and so do every other dentist. These are common things.
Just they never smile, so we don't see it.
Right. I don't see it. You don't see it. People don't see it because they're too self-conscious about their smile. So he comes in. He's just as concerned about his smile. He doesn't want to have something he takes in and out. He wants it to be permanent. And he just wants to know if he can do it. Once again, it's one of those top 5 things. So, but when you look at this gentleman, you think the same thing. Look at his teeth. Does he take care of himself? Before I finish it, let me tell you about another gentleman that came into my office.
Okay.
He comes in, he's in his late 20s. And he's been my patient for probably 8 years. So he started when he was around 21. He comes into the office, and all of a sudden, his teeth are like this gentleman's. Terrible. He comes in one day and says, I'm ready to do my top teeth. I want to get them taken care of. I said, what has changed? He says, I went on a blind date that my friend set me up with, and we had a great time, and after it was over, I tried to call, and she wouldn't call back, didn't want to talk to me anymore, and my friend said the reason why she doesn't want to go out with you is because she saw your teeth. She's worried if you take care of yourself well enough or not because of your teeth. He says, I take care of myself. I don't want this to ever happen again.
So you fix his teeth?
So we fix his teeth. He has all of his top teeth. He has some temporaries that we put on. Temporary meaning he had temporary teeth that he didn't ever take out. So 2.5 weeks later, he comes in to get his permanent teeth. 2.5 weeks.
Yeah.
In 2.5 weeks, he walks in with a girlfriend, not a girl. He walks in with a girlfriend that saw his teeth, not the same girl. She was out, but he walks in with this girlfriend because he had a great smile and he wasn't afraid to smile now. So he walks in now, he has self-confidence and it shows. He has a girlfriend now. And we put his teeth on. He was excited. He was just a different person.
So there's a lot of people like that, 60s, 70s, 80s.
Common.
And you give them great teeth and they feel
right. And this gentleman was the same.
So him, what'd you do with him?
So let me show you. Just picture, I mean, what he would look like.
He was
with
also
good teeth.
going to have a denture.
Right, he was. And he didn't want a denture. He was hoping he was a candidate for implants. Remember, he walked into my office, so there's a good chance we can do something with implants. People are afraid maybe they don't have enough bone, something, but all they have to do is discuss it.
You could work with them.
Yeah, I can work with them. We just customize a plan for each person.
All right.
So when he comes in, this is what he looks like now. Take a look at him now.
Yeah.
Now he's got his sunglasses on in this picture because he just stopped in like a week and a couple weeks after we gave him his final teeth. He was so appreciative. So he comes in, he simply just comes in to say thank you. It was great.
Yeah, he does look different. I mean, he looks kind of mean in the before, right?
Well, yeah, he just didn't know how to smile because and this was asking him to smile. And he didn't want to. And now he's not afraid to smile. It's great.
It's very nice, very nice.
So let me show you this. This is a lady where people ask, how soon can it be done? She was headed for dentures. She didn't want dentures. She'd been to 2 or 3 different specialists and people in the area that said you are not a candidate for implants. She was told she had to have dentures. She was a candidate for implants. And so she didn't want to have something she took in and out. That was so important to her. So this is what she looks like now. Now you have to remember, she did not want to have anything she took in and out, and she was told she had to have dentures. This is what she looks like now, does not have to have anything she takes in and out. And look at her smile.
It's very nice.
I mean, it's just amazing.
You
just
know,
so
it does,
comfortable.
one thing it does, and you told me this, that it increases their attractiveness.
Right.
And also, they look a lot more sophisticated.
Well, they do.
In the
And here's the
before
thing.
and after.
Here's the thing. You look at before and after pictures and you think, oh, they touched up the afters and they did this. Well, sure, this is a professional picture before. The other one took in the office. But their face, we didn't touch up their face. We didn't touch up their self-confidence on the picture. We simply gave them teeth that they're happy to have and happy to smile with. And they're not self-conscious about it. So when they come in and they smile for the after picture, they're gleaming. They're excited to smile.
Now, I know a couple of denture wearers, right? And they seem to be fine with their dentures. Are you saying there's no such thing as a happy denture wearer?
So why are they going to talk to you about if they're happy with their dentures or not?
Okay.
You're not a dentist. You're not going to know. So they come in and see me, and if I see 10 denture wearers, 9 of them are not going to be happy. The 10th one says they're happy
So
with them.
everything should be stabilized onto dental implants. I mean, is that what you think? I mean, that's your philosophy?
I think that would be ideal. That would be ideal. And the 10th guy, like this, remember the 92-year-old man that didn't want them, but when his wife got them, he was excited about them, wished he'd done it 20 years ago.
You brought a video, and we are short on time. So this video is a woman, and I saw it in the green room, biting, like right after you gave her permanent set of teeth, she's biting into an apple. Anything else you want to set up about this clip?
Well, the important thing about this one is when she first came in, she said the same thing we talked about earlier. I would like to be able to eat an apple again. I haven't eaten an apple for over 20 years. So I told her, when we give you your final teeth, we're going to give you an apple. And she was surprised, but that's exactly what we did.
You know, and I have dentists on this show, and they say, no, you can't really do that, not on the same day. So this is okay to do.
Absolutely. It is. You put the implants in, you put the denture on, and you can do it the same day.
Same day.
Same day.
Okay, let's take a look at the clip.
Okay, now this isn't rehearsed. This is the first time.
I know.
After Kathy got her dentures, we said we'd be able to eat an apple. Ready?
Uh-huh.
Go ahead. Well, look at that. The bite of the apple.
Yeah.
Excellent.
You know how long it's been? Long time. 20 years
Well, good.
since I've been able to bite an apple. I used to eat corn on the cob just with my bottom teeth.
Uh-huh.
Mm-hmm.
Great.
Cool. That's
Excellent.
good.
All right.
That's good.
Great.
Mm-hmm.
Very nice. That's typical?
Yeah, that's typical. I mean, that's a normal situation to happen.
Well, she was happy.
She was excited.
That's
Right.
so funny.
She was excited
It's very
finally
nice.
for 20 years. Yes.
Now,
yeah.
when a patient goes in, let's say they either have a complete denture or you can't save their teeth and they have to be extracted. What are their options as far as dental implants?
They would have 2 implants, so the denture snaps in and doesn't fall out, which I don't prefer that. I prefer to do at least 4. What we like to do is to do a fixed denture that you screw in and it never comes out.
So a
That
full
would be
arch
the
of teeth
ideal
that
option.
doesn't come in and out.
Full arch of teeth, permanent teeth that don't come out. That would be the best option. But it starts with the 2.
Okay, so 2 implants, snap in, snap out, no more adhesive, things like that.
Right.
But ideally, the fixed set of teeth.
Yes, people by far like the fixed better.
So nobody even knows that they, for example, it's undetectable. I mean, because the smiles look natural.
Well,
Is that
right. You've seen some of these pictures, yes. I mean, they look great. People don't know that they're dentures, especially when they don't have to take them out. When they're eating, they don't have to run into the restaurant in the bathroom and take their teeth out and clean them and scrub them and hurry and put them back in because they're fixed. They're the closest thing to having your natural teeth back.
Do you think if, I know you can't do this like a test drive on this whole thing, right? But if you got a bunch of denture wearers and just let them try out a fixed set of teeth over the weekend, they probably couldn't go back to their denture.
You know, that's great because I ask a lot of these people, look, what you paid for this, regardless of the amount, if I gave you triple back what you paid me, but you couldn't change your teeth, you had to take what you had before I started, would you do it? And every single one of them, no way, I wouldn't do it.
Wow.
I would triple because now it has so much value because now they have been test driving it.
Now we should mention that Medicare, Medicaid does not cover the cost of dental implants here in the US.
Right.
And most insurances, even the best dental insurance, like maximum payout $1,500 or $2,000, does
Right.
not cover the whole thing.
Right.
So what do you do for those people that are on tight budgets?
Most people are. Most people are on a fixed income. So we have finance plans that we can customize for whoever comes in so that we can work something into their budget and work a plan that works for them. So implants, people think they're too expensive. That was one of the 5 things that they thought. So we had one lady come in that didn't think there was any way she could afford dental implants. We were able to make it fit into her budget and we customized it for her and she left with dental implants that her denture worked with.
Okay, good. Now you brought more photos. We have time for a couple more.
Okay, great, good. This photo, this one's dear to my heart. And let me tell you why. This is my dad.
Oh, okay.
My dad, I tried to get him to come in to see me for 17 years. This is a true dental person that's afraid of the dentist. Finally, when his teeth got to the point he couldn't chew anything, he called me and said, listen, son, what can you do for me? So he came in, we did everything. He lives in northern Utah. In 3 days, we put in the implants, had the lab make the permanent teeth. I gave him a set of teeth the same day, so he didn't leave without teeth. We're not ever going to send anybody out without teeth. But his final teeth were done in 3 days.
So this right now, that was his smile? I mean, that was him smiling.
That was him smiling. That's his smile. And he's not an unhappy guy. He's as jovial as they come. And so 3 days later, this is what he had with a set of teeth that stayed in. And just...
So he can eat whatever he wants.
He can eat whatever he wants.
Like what? Because it's your dad, you're able to ask him, like, what's the best thing about it for him?
The best thing about it for him is the fact that, certainly he can smile, but he can eat whatever he wants. He can eat corn on the cob, he can eat apples, he can eat steak, you name it.
You worked on him for 17 years. Did you finally say, I told you so?
You know what? He's afraid of the dentist. He didn't come and see me. He lives in northern Utah.
Yeah.
So finally, when he came in, I said, Dad,
but when it was all over, did he say, you know what? I should have listened to you?
Of course. What he said, he lived with me for those 3 days after the surgery. The first thing he said the next day was, I can't believe I'm not in more pain. How come I'm not in more pain? He was just stunned that he wasn't in more pain. And knowing that, that's what was keeping him from coming in. After knowing that, then he said what so many people say, I should have come in and gotten this done earlier.
But you do IV sedation there, right?
Right.
Which is unusual for a general dentist.
Right.
So that way, they go in, they don't feel anything, obviously.
Right.
They don't even have a memory of it sometimes. Is
Right,
that true?
exactly. That's exactly right. Most people say, I want to sleep through it. They don't have to remember. So we do the sedation, and then when they wake up again, then they don't remember anything. They love it.
Okay, we have time for one more.
Okay, one more. I save the best for last.
Okay.
I want you to look at Kevin here.
Wow.
This is Kevin when we asked him to smile. So this is him smiling. We said, Kevin, you need to smile for us.
Now you're laughing because you know the end result,
I know
right?
the end result.
Okay.
Right.
I
So
can't wait to see this one.
This is his smile. Now Kevin simply just wanted something he didn't want to take out. He did not want to take something out. He did not want dentures. And Kevin, the interesting thing about this was he has a beard here because he didn't want anybody to see his teeth. Felt bad about the way his teeth looked. So I want to show you what Kevin looks like today. Amazing result.
Now, like not even the same guy.
No, not even the same. I mean,
you would not recognize that that's the same guy.
No, you wouldn't. You wouldn't. And look at his first picture. This is a great guy. He lives in a little town called Manti. He is just as hard a worker as they come. I mean, this is just a great guy. And you would never think that. People would judge him from the first pictures that I showed you. But now, you look at this gentleman, and he's a gentleman. And he's got confidence now.
I can see where people would prejudge him in the before.
Completely unfair judgment. But now it's wonderful to make this change.
So these people are all over the place. Even people with money, it's just the fear of the dentist. I mean, what's your take on why they don't do it? I mean, is it just the fear, like it's a hassle? Because nobody wants to go to the dentist.
It's all the same things we talked about at the beginning of the show. They're afraid to come in, and they don't have to be afraid. We have sedation, so they don't have to worry about the procedure.
No more excuses.
No, and then afterwards, from several people, it doesn't hurt. They have very little pain. They have very little pain afterwards.
So same day. I mean, look, in a perfect world, you could take, you said this earlier, you could take a 75-year-old, 80-year-old, and if everything works out, I mean, literally they could go in the morning,
right,
and at the end of with no teeth, and at the end of that day, they have teeth.
They have teeth that they don't have to take out, that are permanent. That's right. It's a common thing that we do.
Now, we are out of time, but the people that we haven't talked about, which is a big part of your practice, where their teeth are just failing. Like bleeding gums, bad breath, and all that.
Right.
And they are still candidates for this.
Right.
Absolutely.
You
get full upper and lower, like a cosmetic smile.
Absolutely. It's simply a matter of coming in so we can assess the situation. And once we do that, we can get things healthy. They can have teeth the same day, and they can be in a healthy situation now. Because it's not just affecting their teeth. Their whole body's affected. People all the time tell me how much better they feel, just health-wise. Not just their smile and their self-confidence, but their health. Their body loves it. Okay. And they are candidates.
Okay, good. I want to thank you for coming to the show. I mean, these are, look, and I've said, I'm not trying to endorse you, but these are probably some of the best, if not the best photos I've ever seen. These are real transformations. They could see these on your website?
Absolutely.
Consultations, how much are those?
Right. If they say they saw me on the Wellness Hour, I'll do a consultation for no charge.
So a complete exam, consultation, no charge, if they mention the Wellness Hour.
That's right.
I want to thank you for coming on the show.
Thanks,
Excellent.
Randy.
Great stuff. You're watching the Wellness Hour. I'm Randy Alvarez for now. I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.